Hello, let's talk breast cancer. You know, October is the month set aside for us to create awareness about breast cancer. And breast cancer is that important. Why is it so important? It's important because it's the leading cancer affecting and killing our women, the leading the leading cause of cancer-related death among women. And there's every reason for all of us to sit and talk about breast cancer. What are the risk factors? How do I modify my risk? How do I reduce my risk? And how do I prevent premature death or suffering and pain from breast cancer? So when we talk about risk factors for breast cancer, there are some of the risk factors you cannot do anything about. There are some you can do something about. So those that you cannot do anything about, being born a woman, it's just what it is. And as you grow, and growing is inevitable. So as you grow, especially as you are getting close to 50 years, the risk of developing breast cancer increases. If you're a woman who attained your menstrual periods early, before 12 years, your risk is higher. If you're a woman who continued having your menses up until the age of 55, your risk is slightly higher. If you're a woman who has no children at all, your risk is higher. If you're a woman who had your first child after the age of 30, your risk is higher. And these are not things that are necessarily under your control. If your mom or any close relative of yours had breast cancer, your risk is higher. If the breast cancer has affected one of your breasts, the risk of affecting the other breast is higher as well. And if you have any form of radiation therapy or hormonal replacement therapy, your risk is higher. And these are the factors that you can do very little about. But the good thing is there are some of the risk factors that you can do something actually about. And what are these ones? Physical activity levels. If you stay inactive, you increase your risk of developing breast cancer. If you are obese or overweight, your risk of developing breast cancer is higher. And this is something definitely you can do something about. Taking certain hormonal medications also increase your risk. And of course, like I said, if you drink a lot of alcohol intake simply increases your risk factor. Just like I said also, if you have your first child after age 30, it increases your risk factor. So these said, how can you reduce your risk? As a general rule, we say keep a healthy weight. Keep a healthy weight by eating healthy. Avoid a lot of processed foods. Avoid eating heavy meals, especially in the later hours of the day. And do a regular deal of physical activity. We say something as little as having a brisk walk for 30 minutes 3 times a week is enough. You know, anything beyond that is good, but at least 3 sessions of brisk walks that last 30 minutes is very good to help you to get a healthy dietary habit to keep a healthy weight. Avoid alcohol. There's no other way to say that. Avoiding alcohol is a good means of reducing your risk of developing breast cancer to some extent. When you breastfeed, it gives you protection. And so we encourage women to breastfeed. Within the first 6 months, breastfeed exclusively. We've actually also found that helpful in enabling women lose the excess weight they put on during pregnancy. So breastfeed, exclusive breastfeed for 6 months. Apart from helping you lose the excess weight of pregnancy, it actually also gives you some protection against breast cancer. And then avoid a lot of processed food. And in the month of October, breast examination, breast screening, regular breast screening. We teach you to do your breast examination for your own self every month. And then at least once in a year, get a professional to examine the breast for you. If you do by your own self, basically stand in front of the mirror, take a look at your breast and see if there's any changes coming up. You are the best person to spot it first. After that, you do the examination like we taught you systemically, press the breast in all 4 halves to see if you feel any lump that is between your hand and your chest. Then you report. In the absence of that, wait, and once a year, get regularly checked. Once we detect something that is suspicious, we take the further steps to investigate it. If need be, we recommend minor surgery first of all to remove a bit of the lump for further studies to be sure, is it a cancerous lump? Is it a non-cancerous? And then further management would continue from there. There is every reason to get screened. In the month of October, get your breast checked. There's no other way. Stay healthy, get screened. Let's all get to detect breast cancer early so we can treat it and beat it. Stay healthy. Wish you all the best in the lovely month of Pink October.